All right, so we're now live here at the premiere, and welcome, guys. Welcome to my channel. And if this is your first time here on the channel, by the way, guys, I'm Corby. And if you wanted to learn exercises or tips on how you can live your life in a manner that is pain free, please don't forget to click that subscribe button, that notification bell so that you won't miss out on anything. And I hope that the videos that I'm putting out here are helping you guys fix the pains and the discomforts that you're feeling. Today, for today's discussion, we'll be talking about foot pain, specifically heel pain. Some people are labeling their pain as a plantar fasciitis. So those are the things, or those are the kind of concerns or aches that I will be explaining here today, or I'll be discussing here today. So what I will do with this video, on this video, is I will run through some questions here on the plantar fasciitis talk and tip support group. So thank you guys for letting me be part of the group. So they've been accommodating to me since day one. So I would like to give back to the community and answer a few questions here in this channel, here in this group, on some of the pains and discomfort that they are experiencing on their foot. So I hope I can help and I can give some clarity on how you can truly fix your heel pain. Okay? So before I begin, so I just have a few announcement. So number one, at the end of this video, I'll be announcing in the comment section below winner for a free online consultation with me, so that we can discuss further the pains and condition that you specifically feel. So what you need to do is just click on that opt-in form below on the comment section, fill that out. Please make sure that you're subscribed in the channel, and then at the end of this video, I'll be choosing one subscriber in which I will give a free online consultation. Okay? And then second is this video is going to be the start of a series of videos wherein I'll be discussing in detail how you can truly fix your plantar pain. So starting today until the next days to come, I'll be focusing on plantar issues or foot pain, and I'll be discussing it week by week from start to finish on how you can truly fix that annoying heel pain that you feel. All right, so without further ado, let us begin. All right, so first question I have here in the group is from Lisa Doberman. So Miss Lisa Doberman asks, I wish I could be sure if it's plantar fasciitis or Baxter's nerve. Trying everything, going on 3 years now. I have first step pain and worse, late in the day pain also. So let's see the comments. All right. Check for calf tightness. If your dorsiflexion is bad, you should work on your calves. MRI will tell you. So Lisa Doberman said her calf is tight and sometimes crampy. I do think an MRI is in my future, okay? Roll calves, foam roller. Stop stretching. Start strengthening your calves. Do 50 calf raises every day. This advice from Mr. Mark Cutler. I have the same pain by Gina Hess. Mine will be 2 years in May, but I am recently feeling much better. I could almost say gone, but I'm afraid to say that. But I'm afraid to say that. Can't say what worked for sure, but the things I have done consistently for the past year are wearing a hard boot night splint every night, drinking a powder magnesium supplement every night, no strenuous exercise for a year, just light walking or hiking, wear my A6 gel Keano, toe foot ankle exercises. All right. Baxter's, and then Rob even here explained what Baxter's nerve issue is. All right. So this is really a good question by Lisa, and I would like to discuss this one with you guys. So she's not sure of what type or what kind of pain she's experiencing. So the first thing that I would like to say with regards to this post is Lisa is on a proper track of thinking. So because she's trying to find out what's really causing her pain. Is it a plantar fasciitis? Is it Baxter's nerve? Because once we understand why it hurts on what and what's causing the pain, that's when we can truly fix something and not just try anything that people advise. So the first step is knowing really what's causing your pain. And plantar fasciitis or plantar pain or heel pain can be coming from different sources. So it could be neurological, wherein there's a nerve entrapment involved, in which case she's worried about. It could also be a musculoskeletal issue, wherein the muscles around the ankle and foot are tight or stiff or experiencing some muscular imbalance, thus causing that overstretch or degeneration of the plantar fascia, and that could be causing her the pain. Or it could also be something that is metabolic in nature. So there are some cases wherein people experience foot pain because of issues with their metabolic system. So they have Paget's disease. So they have this different kinds of diagnosis. So that's a different issue, and I will not focus in depth on that with this question. But very good thinking. So know what's causing your plantar pain or heel pain. So it's always a battle between whether the pain that you're experiencing is neurological in nature or musculoskeletal in nature. So some people experience foot pain because of an issue with their back, and then they're trying to work the foot and do everything, do the exercises, do the tips, uh, drink this types of medicine, but still to no avail. It doesn't work because the issue is coming from a different source, in which case it's coming from the back. So Baxter's nerve is an entrapment of a nerve. It's a lateral plantar nerve that exits underside of our foot. So this is your foot right here, and this is your plantar fascia. So underneath it, there are nerves that exit there. So it could be entrapped there, and thus causing pain here on the foot all the way down to your heel. So it can be on the inner side of the foot, or it could be on the outer side of the foot. All right, but how you can distinguish if it's a plantar fasciitis or a Baxter's nerve? Okay, so for plantar fasciitis, the cardinal sign is a first step pain in the morning. So every time you step, your first step in the morning, it's a sharp aching sensation. And then as you go along or as you walk forward, the pain lessens. So that's a classic plantar fasciitis sign. With the Baxter's nerve entrapment, the tendency is this is how you can differentiate. So because the Baxter's nerve supplies the area of your fourth and fifth digit, so this one, so the fifth digit and then the fourth digit, you will have an muscular weakness, or you will experience the inability to open up the fourth and fifth finger if the Baxter's nerve is entrapped. You will also feel a tingling sensation on the area in which it supplies. In this case, the inner part of the foot of the heel and then the outer part of the heel. Other things that you will consider is when you put pressure on the foot or when you tap your heel here on the inner side or here on the outer side, you will experience that radiating sensation from here going up. That's a sign that it could be a nerve entrapment or a Baxter's nerve entrapment. But the perfect answer has been given by some people here in the comments, which is an MRI. So that's correct. But a lot of people don't have access to it. And if you just know some physical assessments or physical examination that you can do on your own, like what I just uh, advised earlier, which is you try to open your toes this way. If you can't open this one, probably the nerve on the underside of the foot is entrapped. So that's one sign or one test that you can do. You can also tap the inner side of the foot and then the outer side of the foot. And if it causes radiating sensation here, radiating sensation here, it could be a nerve problem. With plantar fasciitis, what you will feel if this is your foot and this is your plantar fascia, what you will feel is if you extend the big toe or lift the big toe going this way, it will overstretch the fascia and it will create or worsen the pain that you feel. So that's actually the best, one of the best tests or one of the physical examinations that you can do at home to know if it's a plantar fasciitis or a Baxter's nerve entrapment. So in short, guys, always know what's the root cause of your pain. So understand what's your diagnosis. Is it a neurological issue wherein nerves are involved? Is it musculoskeletal, in which the fascia, the muscles are affected? But in some cases, it could be also both, wherein those two systems of the body, the neurological system and the musculoskeletal system, is affected. In which case, you need to treat or you need to do some treatments or exercises on both systems. Okay, so that's how you will differentiate what's really causing your pain. Once you know what's the cause, you can 80 to 90% prescribe to yourself what's actually going to be the perfect or the best treatment for your heel pain. All right, moving forward, Lisa Hill, I get an amazing stretch in my calf using this rubber band. This one is actually a good stretching of your calf, especially if you cannot bear weight on your foot. Pulling your ankle going this way really creates that stretch of the calf muscle. And with some cases of a plantar pain or plantar fasciitis, calf stretching is really good. Some cases it doesn't work, some cases it works like magic. Now I will be sharing to you guys in which type of demographic the stretching would work and in which type of demographic the stretching would not work. So one of the things that is not discussed thoroughly online is some of the risk factors that is involved with regards to having foot pain. So one risk factor for plantar fasciitis is your foot type. So there are three types of foot posture. So there's an overpronated foot, there's an overly supinated foot, and there's a neutral foot. So if your foot is overly pronated, so if this is the foot, so this is the right side of the foot. I hope you can see, guys. So this one is the pronation we're in. This one is the supination, I mean, wherein the foot is like that. This is pronation, wherein the foot is overly pronated. Your arch are dropped, and then your toes are facing outward. So that's pronation. Now there are some cases that people are overly supinated, or they have this high arch, in which case their plantar fascia here, because the arch is high, the plantar fascia is shorter, and the calf is really stiff and tight. Now with pronated foot, what happens is this fascia is really elongated, and if you try to stretch it more, it will cause pain. So if you're someone who's overly pronated, so as much as possible, you just wanted to stretch your calf and not create that big toe extension, so you would not pull on your uh, plantar fascia. But there's a big connection of the calf muscle and the plantar fascia, in which case stretching would not be that effective. What you can do is really work on strengthening the arch of your foot, which is, if this is your foot right here, sorry, like creating that doming effect of the calf is really going to help you decrease that pain that you experience. So if you're overly pronated, work on your arch, strengthen the muscles of your foot that will promote that arch, which is your tibialis posterior. So the movement is for you to work on that muscle. So if this is your foot right here, if you turn your foot going this way, the tibialis the tibialis posterior is being worked, and the muscles here, that's a muscle that will support your arch, and it will definitely help you with the foot pain that you feel. If you have a high arc, so I suggest you do stretching a lot on your calf, on your plantar fascia. So do this type of stretch that big toe also. Like you can place that band on the big toe so that you have that big stretch on the plantar fascia in the calf. So I just wanted to differentiate here, especially from those of you guys who are really confused whether you should do stretching or not. So in summary, if you're overly pronated, work on your muscles, strengthen the muscles of your arch, or strengthen the arch, the muscles that are responsible for the arch of your foot. If you're someone who's overly supinated, do stretches on your calf and plantar fascia. It will work. It will give you wonders, or it will really fix or improve the pain that you feel. Okay, so moving on. So the next question is coming from Joe Jenny. So she asked, does anyone else get knee and calf pain with plantar fasciitis? So there's a lot of comments actually. Ginger root, organic and raw, calf pain to the max. Yes, patellar tendinitis or runner's knee, bad calf, ankle pain, horrible calf pain. My knee and calf hurt so bad, even if my ankle gets gross. Okay, so Miss Joe Jenny, there's two possibilities here with regards to your question. One is I wanted to know where that knee pain is located. Is it on the front side of your knee, or the front part of your knee, or on the back part of your knee? If it's on the back part of your knee, and then it runs along from the knee to your calf to your foot, I would definitely go and check my hips and my low back. So check to see if the pain is coming from there. So you can have yourself or get yourself assessed online by a medical practitioner, or you can go to a clinic or a hospital that can do that for you. But at uh, I would definitely look in your hips and your low back to see if there's an entrapment of a structure of a nerve going on there. Now, it could also be biomechanical in nature. So, if you have a loss in ankle dorsiflexion, meaning because of the pain that you experience on the foot or on the sole of your foot, you don't like to dorsiflex your foot or move your foot going this way because it will create more pain. So, what will happen is you will experience that loss in this movement, and loss in ankle dorsiflexion is a common problem with people who have knee pain, or people who experience knee pain tend to have tend to experience a loss in range of motion of the ankle, and also loss in range of motion of the ankle can cause knee pain. So the tendency is the knee will compensate for the lack of movement on the ankle, thus causing that anterior knee pain. So if you're someone who's experiencing that patellar pain or anterior knee pain or patellofemoral pain or patellar tendon pain, it could be because you are lacking that dorsiflexion of your ankle. And stretching your calf, working on your range on your calf will definitely do the work to fix that. But if it's coming from behind, like, and then it runs from your knee to your calf to to the soles of your foot, I will be definitely looking at your hips and lower back. All right, so the next question is coming from Christy Aurora. So she's been recently diagnosed with PF. What do you do for pain? Sitting, laying down, standing, everything I do hurts so much. So this is an acute case or an acute condition wherein probably it's like few days, 3, 4 days, wherein she was diagnosed with PF, or she's been experiencing it for a week or two. So what you can do with this type of condition is, number one, understand first what activity provoked that plantar pain. So with PF, very often the leading cause of PF or plantar fasciitis is a sudden change in activity. So for example, for years now you've been just sitting at home working on your desk, and then one day you decide to run or jog outside, and the next day your foot hurts like hell. So usually that's one of the mechanisms of injury of PF or plantar fasciitis. So you need to understand what is the eliciting activity that provoked that pain, and then stop that immediately or lower down the volume of that activity if you can't stop it completely. But as much as possible, you wanted your plantar fascia or your fascia to rest on its job, which is to support your load and absorb forces. So when you run, jump, sprint, the plantar fascia is working to absorb energy and support your weight. So there are moments wherein the muscles around the foot is weak, or you're too heavy, in which case the plantar fascia cannot bear the load. That's why it will create pain, and your plantar fascia will be overstretched, or there will be some collagen deformation or degeneration going on there. So what you need to do, number one, is to modify your activity. So stop what's causing the pain, let your body heal, and do some activities or exercises to fix and heal your plantar pain. Okay, so if it's an acute case or an acute condition, what you definitely can do is assess your foot if assess your foot profile. So are you overly pronated or are you overly supinated? And then once you get to understand your foot profile, if you're overly pronated, I want you to correct your pronation with some sort of a heel lift or a support shoe. If you're someone who's overly supinated, I wanted you to do something that will control that supination, like probably wear some inserts or a type of shoe again, wherein that will be corrected. But only in acute cases because you can't really bear down the pain. But the key in fixing it completely or totally is for you to train your foot to move inward or to supinate well and pronate well, in which I'll be discussing with the videos that I will release later on. So Miss Christy Aurora, please watch out for that series of videos. So if this is if this is your first time watching here on this channel, please subscribe to the channel. I'll be giving out tons of content that is really good that I believe will really fix a lot of people's foot pain or heel pain. All right, so one last question and then I will conclude. All right, last question is would be coming from Katie Arnold. So she asked what pain meds, if anyone does, take one for PF. So what this is all about medicine. So ibuprofen, physical therapy, Tylenol. I have PF on both my feet, elevation. What's this? Med massager. Wow, that's fancy. Mobic, Biofreeze, foot massager, anti-inflammatory drugs help me. Try pain relieving shoes for plantar fasciitis. All right. Okay, so to answer that question, Katie, have with regards to the pain meds. So number one, there's no such thing as pain relieving shoes for plantar fascia. So it doesn't work that way. You have to assess first your foot before looking at shoes. So that's one thing. And then second is plantar PF or plantar pain has been misconstrued as an inflammatory condition, in which case it is not. So what happens with the foot is it undergoes that collagen degeneration, wherein especially if the plantar fascia cannot bear the load anymore because of the activity that you do plus your weight. So the tendency is there will be collagen deformation here on your fascia or collagen degeneration, in which case it will like create those micro tears on your fascia, and you can have pain either from here all the way here or anywhere here on this part. So for some people, anti-inflammatory meds work, but with a lot of cases or with a lot of patients, it doesn't help. So what I see that helps a lot of people who have PF is magnesium sulfate. So they're using Epsom salt to to work on their foot. So I saw also some people who've been using acetic acid as a treatment for PF, which can also work. I'll discuss later why. And what else for pain meds? Actually, that's it. Some people tried PRP or plasma rich platelet therapy, and it's a very conflicting evidence. Now, the reason why magnesium sulfate and acetic acid works is uh, their chemical components can stimulate a specific structure that is found on your plantar fascia, which is your hyaluronan or hyaluronic acid. So hyaluronic acid, in combination with your collagen, is what your plantar fascia is made of. And hyaluronic acid is a structure or a component of your plantar fascia that helps with regeneration, helps with nociception or pain, and it can also help with angiogenesis or formation of new fibers. So hyaluronan or hyaluronic acid is one of the key structures on your plantar fascia that uh, we wanted to stimulate for us to promote healing. So hyaluronic acid, these are the fluids that you found or the chemicals that you found inside the knee joint, like the synovial fluid. So synovial fluid is filled with hyaluronan, and it's responsible for lubrication of the tissue. So so that your fascia can slide better when you move your foot. And they're also responsible for aggregating water, which can help rehydrate the tissue and start the regeneration process. So there is a manual therapy techniques that has been proven to promote hyaluronan, and that's what I'll be discussing in the future videos. So magnesium sulfate can also stimulate this. Some people use ultrasound along with acetic acid to promote also healing on that tissue. But with acetic acid, it's like a conflicting evidence. I can see a lot of people who've been using Epsom salt, magnesium sulfate, and it works wonders on their foot because it can stimulate that chemical, which is your hyaluronan. But even without pain meds, you can also improve or work that tissue. All right, now it's time to. So I think we can stop from there. I hope I've answered a few questions that people have with regards to their pain and discomfort. Now I'll be announcing in the comment section who's the winner for the free online consult. Again, this is just the start of a series of content about plantar fascia. So I will try my very best to dissect everything, make everything clear for you guys. So if you have any questions or concerns with regards to the video here, just please comment it down below, and I'll be happy to answer your questions. I'll be staying here at this live video for 2 hours, 3 hours, 4 hours answering your questions. So please comment down below. Please subscribe in the channel. And again, welcome everyone. It's nice to uh, get to know each and every one of you. Bye, guys. Thank you.